Hello, sir.
Hi.
Welcome to the Suchitra Cancer Care Onco-Talk series.
Thank you.
And we are creating some cancer awareness videos.
Thank you. Thank you.
We are so grateful to have you here. And we would like to start with your brief intro.
Yeah. So basically, I am a head neck surgeon, and I am practicing this for the last almost into it for last 10 years now. Out of that, part of it was the training part, and then continued doing that.
Okay. So we would also like to know about your background, like where did you studied from? And
so basically, I did my master's in facial-maxillary surgery from Chennai, and after that, I did my clinical fellowship, then followed by my research fellowship at Tata Memorial Centre, Mumbai, in head neck oncology, and then I continued working in TMC at its new center in Muzaffarpur since late 2020, early 21, and have been there since some time now.
okay. So, since we are talking about head and neck cancer, so in simple terms, what is head and neck cancer and which parts of the body are most affected?
So basically, head and neck cancers are a group of cancers. Okay, they have multiple sites, and these sites are basically the oral cavity, the nasal cavity, the nasopharynx, and as in the part of the nasal cavity which is behind the nose, the throat, I mean to say the pharynx, the oropharynx or the hypopharynx, and the voice box, which is the larynx. So these are the major sites of the head neck cancer. Of course, then there are others like the thyroid, the parotid glands, the salivary glands, what we call, the skin of the head and neck region, and some rare tumors of the eyelids and other regions of the head neck. So it's a large group of multiple cancers.
Okay. और इंडिया में कितना कॉमन है ये कैंसर?
इंडिया में it is one of the most common. If you see the entire, अगर ये सारी sites को हम club कर दें, so they account for somewhere around 1/3 of all the cancers in the body. So somewhere around 1/3 to 1/4, depending on what geography of India it is. थोड़ा सा geographical disparity है इसमें. There is a slight amount of geographical disparity which is there. It accounts to somewhere around 16 to 20% of the of all cancers among males. Most of it is tobacco induced, and somewhere around, if I have to give a number, of the 14 lakh cancers every year in India, what we get, somewhere around 3.5 lakhs are the head neck cancers which we have.
Okay. And with your experience, सबसे ज़्यादा क्या reason रहा है like इस cancer का?
Okay. So most common जो सबसे ज़्यादा reason है, no doubt it is tobacco, alcohol, and Areca nut to some extent. And these are the three leading causes.
And consumption of alcohol is also responsible?
Yes, yes. It has shown both independently as well as in association with tobacco, both as an independent risk factor as well as in association. And now it's proved beyond doubt that with that poses a significant health risk to develop these head neck cancers.
और early signs and symptoms क्या है कि like patient doctor के पास जाके?
So early signs and symptoms can be like as you say, with tobacco, people consume it for a very long time. People smoke. Now smoking is also, which is very common, and they smoke chronically for a very long time. So any kind of an ulcer in the oral cavity or in the tongue, which is not healing for a very long time. I mean, that long time is somewhere around three weeks. Then it is a concern. And so that's something which you should be aware of. Any early change of voice which is persistent for more than 2 to 3 weeks needs to be checked either by a head neck surgeon or a local ENT specialist, or if it's in the oral cavity, a dentist. Anybody can easily see these early signs. There can be also sometimes development of a neck node, and certain hidden cancers of the head neck region may develop, may throw a sign of a neck swelling, and if this neck swelling is persistent or is increasing in size, that is something which is to be as an early sign, taken as an early sign, and should be reported to a physician or a surgeon.
Okay.
One point to note is most of these head neck cancers don't present with pain. So initially they don't have pain. So that's something which everybody, for the public, is one thing, that not everything which is painful is only something which is alarming. Many of the cancers, when they start, they are painless.
Okay. And when should the mouth ulcer or soreness taken seriously?
If it is somewhere, if it is persistent, okay, and after stopping the local irritant or a local infection, or if it is not stopping for more than 2 to 3 weeks, it should be reported.
Is lump or swelling always a sign of cancer?
No, I don't take it that way, that any lump or swelling may not, but then if it is persistent and there are no other reasons why it is there, okay, then it is a cause of concern.
Okay. Are there any screening tests or regular checkups recommended by you?
Yeah, so the only thing currently recommended for screening or for early detection is a visual inspection of the oral cavity or the head neck region by a scopy or an endoscopy. That can help. And I do recommend that anybody who is a high risk for developing these cancers, like if they have a habit, or they had a habit which was there before, and even though they have reformed, they should undergo examination, okay, and which is basically just a visual examination. There are multiple other adjuncts which are there, but they have limited advantage.
Is there any vaccine?
Currently we don't have, but with terms to oropharyngeal cancer, which is more common, and it is also catching up in India, HPV vaccine helps for oropharyngeal carcinoma as well, but still the Indian data is yet to come, and we don't know for sure.
We would like to know about the treatments of the head and neck cancer. Like the chemotherapy, radiotherapy.
There are basically 3 major modalities of treatment. One is surgery, then there is radiotherapy, and then there is some form of systemic therapy, which is either systemic therapy in the form of chemotherapy or immunotherapy or other targeted therapy. So I think those are the major verticals in the treatment. But having said that, there is a lot of integration of all these treatment modalities, which actually helps the patient with a better outcome.
Surgery is really a big thing for us, like everyone. How much people are aware about the advanced technologies of the surgery?
Yeah, so in today's day and age, surgery sometimes, which is very ghastly, and people feel as if it's very disfiguring, it has no more remained that disfiguring anymore. There are good reconstructive methods which are available, and sometimes with newer combination of modalities, there are instances in which lesser surgeries can be performed. There can be some amount of organ preservation which can take place in multiple settings, in multiple organs of the body, of the head neck region. So surgery is a very effective modality, and there are techniques which reduce the overall side effects of surgery, and it should not be feared that way, because surgery also has advanced in the field in the last few decades. We have better instruments, we have robots, you name it. We have endoscopes, and everything is there meant to make it minimally invasive. Having said that, the whole idea is that to reduce the morbidity of surgery, and there have been significant advances which have taken place in the last 2 decades to reduce this morbidity.
Are the people from our region are aware of this?
Yeah, they are kind of aware. I mean, उनको पता है कि अभी early detection, और अगर हम early surgery करें तो advantage है. There is less disfigurement, there is less side effects. So in the last few years and almost a decade and a half, a lot of newer modalities have also come in, from the robot to endoscopic resections, and that reduces the morbidity and the good reconstruction also which is available. So the morbidity, I mean the problems or the adverse effects of surgery also have reduced. The disfigurement, the dependence on tubes for feeding, and all those things have reduced in terms of rehabilitation, of getting your own teeth back and able to chew your food. All those things have also improved in the last a decade and a half. And the surgical resection and that also, the preservation of the organ, say the mandible, say the larynx, the voice box, also has been there. And I think more and more the outcomes of surgery have improved. The morbidity of the surgery is also being reduced that way. So there is some advancement in there. And so the message to the public, what I would like to give is that surgery is a very important modality, and it can really help the treatment outcomes, and we should not be afraid of surgery anymore. Surgery is extremely safe. The safety of surgery is good. It's not at all dangerous in terms of the events which happen. It is no more ghastly anymore. It is not disfiguring. There's a lot of attention given to return to normal life, and it's a fair time-tested modality.
Yeah, and what is the timeline of this surgical treatments?
Generally, timeline, you mean to say, I guess, is that the recovery phase, and how does
once the person is diagnosed with the
surgery, okay, with the cancer. So mostly when the tumor is early, and most of the squamous carcinomas of the head neck region, in some form surgery when it is very early is a single modality. And as a single modality, surgery can be offered to these patients, and generally the earlier the better. And after the surgery, it generally takes around 3 weeks to recover almost to 70 to 80% of the pre work which is being done. And there are attempts and efforts to reduce it to 1 week and lesser, to fully get rehabilitated and fully return to function.
What is the percentage of having reoccurrence of this cancer after the
after surgical treatment? So if you see the entire cohort of all advanced and locally, for the early cancers, the chances that the tumor may come back generally range from 20% to 25-30%. When it is slightly advanced cancer, it ranges, the chances of coming back range from 50 to 40%. So that is those are the numbers, largely speaking.
Okay. And what kind of patients you see at your hospital in Muzaffarpur?
Unfortunately, in Muzaffarpur, we see a lot of advanced cancer. I mean, most of our head neck cancers present in a very advanced stage. And That's a bit of a concern in our country. And being a public funded hospital, we do see a slightly more advanced patients who visit our hospital currently, and they require multimodality treatment.
Okay.
So it's not that they only require surgery or radiotherapy or only some systemic therapy. They need all of them together.
Okay. Are there enough resources there?
They are building up. Okay, our center at Tata Hospital has now all the basic infrastructure and the resource for the comprehensive management of these cancers there. But overall, I would say that entire region of North Bihar needs further strengthening of these facilities.
There must be so much patient from low cost regions, low resources settings. Any treatment options or advices for those patients?
So I would like to tell them that cessation of tobacco or any other habit like Areca nut, the betel nut, or what they call it all as supari or kaseli in the local language, that needs to be done first, and also they should undergo some screening if they are high risk. Many of them are high risk. If you see the GAT survey, somewhere around 43% of the males in Bihar have some history of tobacco. And in such high population, having such high risk behavior, we need to get this message across that they need to be forthcoming and health seeking in terms of screening.
Okay.
And that is one thing which I would urge them. And yes, so cessation and getting themselves screened is the first thing to effectively reduce the burden of cancer, probably identify pre-malignant lesions. There are a lot of these conditions which are pre-malignant. I mean, they transform into cancer. There can be some long-standing white patch which is there, or a whitish reddish patch in the oral cavity which is there, which may then transform into cancer, and those also needs to be managed. So that would be my suggestion.
In our region, like in Bihar, which age group is mostly diagnosed with these cancers?
Fairly young people, I would say. We do get people in their 30s and in their 40s who develop this cancer. The initiation to habit, and there are studies which say that the first initiation to habit happens somewhere around 12 to 13 years, and that's the age when they start on habit. And that's a bit of a concern, and it makes us all very uncomfortable, with the even though that there are multiple, the COTPA Act and other things are there that we should be reducing the access to these vulnerable groups of adolescents and in the school and the colleges. But having said that, there is a gap in the overall implementation, and that leads to these presentation of these cancers in this very young age. I mean, they're 30s and they're in their 40s, they're in their peak of their family life.
How much effective this COTPA Act is?
I fear that it's very good in the intent, and but I think we need to do a serious reckoning on how effective this has been, and
especially in our region.
It's in our region, and so that's something which we all need to reckon.
Correct. Any last message for the caregivers?
The caregivers are the backbone, actually, of cancer care, and we have a very good culture of caring in our society. We just need to harness that. And what I feel is that empowering the caregiver, making the right kind of health information accessible to them, making implementation of certain health benefiting strategies in oncology. If we empower the caregivers, that can really help us implement those. Say for exercise, say for implementation of certain health routines, immediate care, post-operative care, or during the chemotherapy care, or during radiotherapy, or in the active treatment phase. That can reduce the overall the toxicities of treatment. I mean the adverse effect of surgeries and the problems that come with surgery, say radiotherapy or chemotherapy, and also reduce the overall burden on hospitals, on the resource itself. So I think I feel that we need to empower our caregivers more, and there's a lot which our caregivers can do, and that's something which I really would like to spread this message that caregiver forms the backbone of cancer care. And
Yeah, very informative. Thank you so much for your time, sir. It was lovely meeting you.
thank you so much.